Today I will discuss with you all insurance. And I'm going to try to persuade you all to purchase insurance today. Why is insurance important? Why? Because it covers you and your family for unforeseen events. To persuade my audience to purchase insurance today, I'm going to start by letting you know that there are need of insurance. The need of insurance is steadily rising. It's easy to take part in, and having it before you need it is very important. There are 4 main points that I'm going to discuss with you. First being health insurance, how to obtain insurance, benefits for you and your family, and how you can help. Do you worry about monetary funds for unforeseen events? I am Tiffany Butler, and I'd like to share with you today the need for insurance. 1, it's a great investment for accidents. The number of deaths are increasing. There's families not being covered, and there are 2 million uninsured Americans, according to the U.S. Census Bureau. My uncle passed away with a heart attack. Had symptoms, but never visited a doctor. Why? Because he didn't have insurance. He didn't have any insurance. He didn't have health insurance. He didn't have life insurance. So it left it for the family. And his responsibility became a family responsibility. Having insurance is important. Like I said, it prepares you for unforeseen events like death, health issues, or what have you. You need health insurance to cover medical expenses. You need life insurance to cover end-of-life expenses. How to become covered is easy. There are several insurance companies that offer different plans, and all you have to do is contact one and sign up. It benefits your family because at the time of an unforeseen event, your family, you may leave back debts that your family can't afford. But by you having an insurance policy, that money can be paid towards your debts. It can pay for your spouse's retirement, and it can pay for your child's education. We know that having insurance is important, so I'm going to start by sharing with you the need for health insurance. People all over the world need coverage. Let's face it. The problem is most people can't afford coverage. Why? Because the premiums are too high, according to KFF.org. Denials, people are getting denials for financial assistance, ones that apply for Medicaid or ones that apply through the healthcare.gov. Families that make minimum wages, they can't afford to pay insurance policy because they're taking care of the home, they're having to provide food for their children, clothing, child care. The income is limited. But with the limited income, the only advantages to that is you may qualify for assistance. Private insurance policies are costly, but not as much as not having insurance. And what I mean by that is, if you don't have insurance, you may pay $100 a month for a premium, but if you're not covered and something happens, you're going to pay 10 times more of that in just medical bills. Now that we have covered the need for health insurance, next let's move on to how you can become covered. Making sure everyone gets covered can solve problems. Raising the minimum wage to accommodate finances. Your insurance will be more affordable because of higher pay rate. Many Americans will improve because they can purchase insurance according to the Economic Policy Institute. They can apply for affordable coverage through the marketplace. That's based off of your income and your household size. You'll receive a premium tax credit that lowers your premium, and they'll apply it directly they send it directly to the insurance company, and it applies it towards your plan, leaving you only pay the balance. This is a chart of the family size. If you have a family size of 1, your income is between $11,000 and $14,000, then you're qualified to receive Medicaid. If you have a family of 4 and your household income is $24,000 to $29,000, you also qualify. But let's say if you have a family of 4 and your income is $30,000 to $40,000, then you won't qualify, but you can qualify for a lower premium of a health plan. Households with low income qualify for medical assistance, and your amount is determined by your income and your household size. Like this chart states, gross income below 138% equals Medicaid, and you apply for that through your local DFACS. Now, modified gross income is used for the marketplace, and they determine your expenses along with your household income that in turn determine the amount of subsidy that you will receive towards your health care premium. So, we just covered how you can attain coverage. Let's discuss how your family can benefit from insurance coverage. Let's look at it. You got costs and you got benefits. Some people think that it costs too much to have the benefits. But in reality, the insurance covers your medical bills, your vaccine costs, free preventative care, and screenings, according to the American Heart Association. So imagine if you were diagnosed with cancer. If you're insured, and your insurance premium is going to take care of all your medical bills and your cancer treatments. But if you're diagnosed and you don't have insurance, then who's there going to take care of it? Vaccines that prevent serious illness can be expensive, but with your health plan is covered. I feel strong about the preventative services because that gives you a chance to visit a doctor, and with your preventative care service, they'll determine, with all the screenings being done, it'll determine whether you have any kind of ongoing illnesses that can be attended before it get a chronic illness. We tend to look over these issues, and waiting too long can result in our death. You now know how insurance can benefit for you and your family. But what we'll talk about now is how you can help. Take action. Getting information out to the public. It can help. How do we get information out to the public? Simply by passing out flyers, pamphlets at events, having a community speaker, going door to door, commercial advertisement, reaching out to your community leaders, and your community leaders will get you with your community health care or a Live Strong Foundation. And they can help find a plan that accommodates you and your family. In conclusion, in summary, I have shared with you the need about insurance and its importance. It is an essential part of living that we need before any unforeseen event. Would you be covered in the event of a medical crisis? Would you have the funds to start a cancer treatment if diagnosed today? Insurance is your coverage and reduce the amount of financial obligations that you have to pay out of your pocket. Insurance is needed for multiple reasons, we know. But keep in mind, the insurance covers your extensive medical care, your preventative screenings, and all of your recommended vaccines. What would you do if your spouse was diagnosis were poor? Know that your plan has you covered for all treatments and medications. And remember that you can contact your community health care leader. Do not put it off another day. The need for insurance is overwhelming today. Will you live knowing that you are covered? Thank you for your time and attention. And we appreciate you for being here today.